Epidemiologic investigations are underway, but yes, it's certainly possible that there's limited human-to-human transmission. It's certainly possible that there's limited human-to-human transmission.
Funding of the World Health Organization while a review is conducted to assess role in severely mismanaging and covering up the spread of the coronavirus.
So what we're hearing this hour is, in fact, that officials within China are, as you stated, they are confirming that there has been human-to-human transmission of this virus, specifically in a province in southern China.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
We have it very well under control. We have very little problem in this country at this moment.
We have a window of opportunity. While the number of cases, more than 99%, are in China, in the rest of the world, we only have 176 cases.
Coming in from China, we're going to see what happens, but we did shut it down.
Let's use this window of opportunity to really invest in prevention, to invest in control, and prevent this virus from spreading. It's time to act.
You know, a lot of people think that goes away in April with the heat, as the heat comes in. We're in great shape then.
The detection of this small number of cases could be the spark that becomes a bigger fire. The spark that becomes a bigger fire.
And you know, in April, supposedly it dies with the hotter weather.
And if the world doesn't want to wake up and consider this enemy virus as public enemy number one, I don't think we will learn from our lesson.
Looks like by April, you know, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
We have over 400 scientists. There's been huge global interest in this topic and a real desire to collaborate and contribute.
And I think the numbers are going to get progressively better as we go along.
Our window of opportunity is narrowing, and that's why we called the international community to act.
We have it very much under control in this country.
We've had enough countries now import disease. It is time to prepare. It is time to do everything you would do in preparing for a pandemic.
Because of all we've done, the risk to the American people remains very low. It's going to disappear. One day it's like a miracle. It will disappear. You know, it could get worse before it gets better. It could maybe go away. We'll see what happens. Nobody really knows. Now the Democrats are politicizing the coronavirus. You know that, right? Coronavirus. And this is their new hoax. The hoax is on them. I'm not talking about what's happening here. Certainly not referring to this. How could anybody refer to this? This is very serious.
All countries can be looking for cases right now. All countries can be aggressively finding those first cases and following those contacts over time.
Shortages are leaving doctors, nurses, and other frontline health workers dangerously ill-equipped to care for COVID-19 patients.
Anybody that needs a test can have a test.
This is not a drill. This is not the time to give up. This is a time for pulling out all the stops.
Are you concerned that the virus is getting closer to the White House?
No, I'm not concerned at all. No.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. And by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
It will go away, just stay calm.
Not testing alone, not contact tracing alone, not quarantine alone, not social distancing alone. Do it all.
We're in great shape compared to other places. We are in really good shape. Yeah, no, I don't take responsibility.
You cannot fight a fire blindfolded, and we cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries: test, test, test.
Well, It's all over the world. It's incredible what's happened in such a short period of time. But I've always known this is a pandemic.
We must get back to be able to control this virus, live with this virus, develop the vaccines that we need to finally eradicate this virus.
You know, when I listen to the press every night saying we don't have the most in the world deaths. The most in the world has to be China. It's a massive country. It's gone through a tremendous problem with this, and they must have the most. And I spoke to them, and this could have been shut down a long time ago.
Please work across party lines, across ideology, across beliefs, across any differences for that matter. That's how we can defeat this virus.
Said many times that the U.S. is doing far better than any other country when it comes to testing.
Yes.
Why does that matter? Why is this a global competition to you if every day Americans are still losing their lives and we're still seeing more cases every day?
Well, they're losing their lives everywhere in the world. And maybe that's a question you should ask China. Don't ask me, ask China that question, okay?
Epidemiologic investigations are underway, but yes, it's certainly possible that there's limited human-human transmission.